Good Sunday morning pre-Christmas to all the knuckle-dragging Billy Goat Review fans. Mike and I have a nice special episode today on pharmaceuticals. So this is going to be a pretty interesting talk nonetheless. But as you can tell, if listeners here, my voice is a little fucked up, I guess, for lack of better words. That's what will happen whenever you go out drinking like a grown man at a Christmas party wearing a Christmas shirt. Is pretty interesting talk, but I think it's one that we'll leave offline. Mike and I can have after the fact. But the fun thing with pharmaceuticals, Mike, we always see a lot of information on television about pharmaceuticals and that anyways, and there's always a large debate on pharmaceuticals, and there's so many caveats that we have on the pharmaceutical world. But I think the nature of our discussion is pretty much how we're gonna, how we view pharmaceuticals and that. But the funny thing is that the world, pharmaceuticals comes from a word that's pharmacology. Basically, that's the study of medicine and biology. But in Greek, check this out. You'll like this. In Greek, the word for it's pharmakon, which means poison in classic Greek, and drug in modern Greek. I thought you'd like that. So I mean, isn't that amazing? I mean, that's the fucking Greeks knew that this pharmaceuticals were essentially not so much of a good deal.
Right.
But it's kind of funny here. I'll kind of walk through the history. I know this is kind of a little bit different format than we usually do on our shows, but I'm kind of digging it right now. It almost reminds me of a Stuff You Should Know podcast almost, but we'll get a little insight on it. But basically, pharmaceuticals, in a way, or at least the practice of pharmacology, has been around for thousands of years all across the world, right? So they say some of the earliest documentation is actually Indian, from India, which I don't know, that's kind of
Snake
surprising.
oils.
Yeah. Dude, take a guess on when this stuff started. You're going to be
Oh
amazed.
no,
Amazed.
I bet 1700s.
Dude, no, check this out. The Indians, it's a prehistoric, it says, these are documents, right, that they've actually found. And I'm going to butcher this anyways, but I'll read it nonetheless. It's the Sheshruta Shimhata, or Hitta, I guess, and is actually from 6th century BC.
What? How do they know that? That
Dude,
shit sounds made up.
I don't know, carbon dated. It's fake science, but even more so, they got records back. It's looking like 16th century BC from Egypt.
Would they do? Find a scroll hidden somewhere?
Yeah, it's some papyrus, something like that. But hey, check this out, though. Where they say, like, you were talking about the snake oils and stuff, but actually, some of the medicines they've used. Oh my God! Oh no, you'll like this. Products like lizard's blood, swine teeth, goose grease, and it says ass hooves. I guess they use donkey hooves, but even more so used. It looks like they put beer, which I don't feel better from drinking beer. I actually feel quite worse.
Yeah, but you're not supposed to drink it in excess. I think they say like
uh,
a beer a day keeps, I don't know, something away.
that's fucking lame. A beer a day. That's just like,
Keeps your wife away.
yeah, I guess, right? Let me see what else. They had juniper berries, opium, poppy. I guess we'll get into that a little bit later, especially with the opioid crisis that we have in this country. Look at this
Oh.
lead. They use lead. So these people are using some random ass shit. So
Well,
we,
didn't they used to make like pots and pans that had lead in it, and then they realized that when people were cooking it was coming out in the food and people were getting poisoned?
yeah. And you ever heard the expression of Mad Hatter?
Yeah.
Well, the reason a lot of these hatters went mad is that they used lead for some substance, and like I guess in the process of making the hats, so you absorb that lead through you, and lead's really bad for your brain. I mean, it's terrible. It really I don't know, it degrades your cognitive abilities, obviously, and basically it makes you crazy.
Right.
So we move forward here quite a ways, and the pharmacology, basically the science of biology and medicine and how they make medicine. We're getting into the 19th century here, where they start being able to isolate a lot of these properties and these drugs. They have poppies, but we'll use poppies for example, and they could sit there and they could isolate the active ingredient in that opium in the poppy. So we're moving forward here on this, and it's funny, you were saying the 17th century, you were pretty freaking close with the pharmaceuticals, anyways. But it's funny here is that one of the first guys to study this is a Francois uh, Magnadi, I guess. I don't know. My French is fucking terrible, but he check this out. He had a plant, right? So he has dogs. I don't understand, why he's sitting here testing dogs and whatnot. But the dog, they used a plant. It had a strychnine in it. Or rutro.
What? What is
Yeah,
that?
strychnine.
Yeah.
Strychnine isn't good. When I think strychnine, I think of what is it?
Sounds
Um,
like something you'd find in coolant for your car.
yeah, almost. Actually, it's more so. God, my brain is working as well as it should this morning. Uh, Kills grubs and stuff. Use strychnine to kill lawn bugs. In large.
Oh.
Yeah, but this guy was using this to demonstrate that the dog's spinal cord was where they could convulse at. Basically, he gave the dogs the drugs to make them puke, and then he found out where it went from. So that's basically the first. We get into pharmacology and things like that, but actually bring it up into the United States. Actually, a lot of these folks, they didn't come to the United States to practice this for quite some time. And what's funny about it, Mike, is once we start getting into that, the it just gets really strange. The research I had, anyways, and I tell you what, if you got what you want me to keep going through the history on this, or I mean, I got quite a
No,
bit.
no, man. Let's get into the nitty gritty here, and I'm curious to
Okay,
know
go ahead.
what you think about what's your overall picture or view on today's pharmaceutical and how it's pushed on us and or used.
Yeah, um,
Um,
you know, we've talked about this before. We live in a culture for instant gratification, right? Like this morning, I'm hungover.
yeah,
I'm hungover. I feel like shit. What's the first thing I want to do? I want to not feel like shit. So what do I go for? I take some medicine, I drink some Gatorade, and here we go. And for me, pharmaceuticals, I don't know. For me, I kind of on the fence about it, to be quite honest. There's quite a bit of good that comes from some of these, and research in the pharmaceutical market. For example, here in 1918, the flu pandemic killed 50 to 100 million people, Mike. 50 to 100 million in
Y-
1918.
yeah, but you got to
Three
think. I
to
mean,
three to
they didn't have preventables back then, though. You know what I mean? Like, I don't contribute that to today's vaccine.
Well, no, and see, and that's what we see a lot of these vaccines nowadays. It may be, I don't want to say they're overpush, because my big thing is vaccine, and these people are like, well, I don't need to vaccinate my fucking kid. Bullshit. Are you serious? I mean, I can understand if you're gonna live in a homestead out in the woods by yourself and you don't
Yeah,
want to vaccinate your kids, go right ahead. But I'm sorry, like, to not vaccinate your kids and then put them in school with other kids, and you risk your child getting polio and all these diseases that it could have been prevented. I mean, I just don't understand that. I just really don't. And it's funny, where we lived at in California, Mike, in Butte County. I read an article a while back that said like 25% of the kids in the school system there were not vaccinated. I mean, that just blows my fucking
yeah.
mind. I mean,
And do
20.
you see any polio?
Well, I don't know. I'm not out there.
Yeah, I think we would hear about polio.
Maybe, maybe not. Yeah, polio and things like that. I don't know. I mean, a lot of times the old adage goes, "Prevention's better than cure."
Yeah, and I mean the whole purpose of vaccines is to get herd immunity, right? I mean, the whole goal I think is to try and get like 96% or more of the population to be vaccinated, and then that way by herd, mob effect, you have too many people vaccinated, which prevents the actual virus from doing anything.
Right. I mean, you negate the effects of it, but
Right. But I mean there's been issues with that, and the biggest one that I found that's like the biggest joke to me is the flu vaccine.
right.
The flu vaccine year after year has been proven to be less than 50% effective.
Wasn't it like
S-
around 30% effective, maybe? I mean, you still get flu. You still get
Yeah.
the fucking flu.
Yeah, you still get the flu. You can get the flu from it, and the flu vaccine has the highest what's it called when you get sick from a vaccine? They have
Oh,
the highest.
effects.
Yeah.
You know
Yeah,
what
they
that
have the highest effects from that vaccine alone. People are getting sick, they're getting injured, and
years ago, Mike, I worked for the Department of the Interior in Amarillo, right?
yeah.
And they're like, "Hey, we're giving away free flu shots at the office." So went down to the office, got a flu shot. 5 hours later, right? I got cold sweats. I'm chilling. I mean, sick, fucking throwing up, stuff like that. So I call the VA. I call the nurse at the VA or whatever, and I'm like, "Hey, I'm sick. Like, I got the flu shot a couple hours ago." They go, "Well, they say sometimes you get a reaction to the shot that is like a flu-like symptom, but it's not the flu." I was like, "Are you kidding me?"
Yeah, like, sometimes when we give you the flu, you have the flu.
Yeah, yeah, no, and that's what's kind of funny. You give these people something that's hurtful, and the one I really like hearing is, the vaccines give my kids autism. That
Yeah.
that
I
cracks.
used to be I used to kinda believe in that until I read a bunch of studies, and they've done studies directly, um, looking for that, and, yeah, they didn't really find anything. Now, I know that people are in the business for not stating that their vaccines cause autism, but so there is some sort of incentive there to find results that state, it doesn't cause autism, or is even like a leader to it.
Right.
But yeah,
But
everything I read pretty much says there's no correlation between the two.
exactly, and correlation isn't causation a lot of the times. But here's the thing too, with
Right.
a lot of these, autism at a time, it was very um, pinned down. You know what I'm saying? Like, if you have this, and this, you're autistic, and if you don't, you're just, a wild child or something like that. But as the spectrum of autism went out, we're talking like Asperger's disease. What else? There's other, even what is it? Operant defiance disorder, odd, which is
Yeah.
pretty funny. They schedule that in to the same as the autism. So there has to be some sort of, I don't know if the psychiatric board, the DSM, the Diagnostic Scientific Manual, like psychology. My dog scratch on the door, asshole. But with with that, we can sit here and make certain assumptions, and it's kind of like what Casey was talking about when I was talking to him on the show a while back about psychology. He goes, if you got 5 out of these 9 symptoms, here you go, you have this. But if you keep adding symptoms in and making a wider range, of course your pool of people is going to get larger that have something to that effect. And that's what kills me. It's like, come on, either this is the definition or this is not the definition. But do you think a lot of that is used to kind of pull at the heartstrings of folks, or kind of almost like you were saying, just placate somebody to get them to feel better? Well, okay, then maybe this did give them autism, or maybe this is a thing to give them autism type
Well,
deal.
yeah, I mean everybody wants to point at something, right? I mean, when your child is fine and then they get a vaccine shot, and it can most certainly trigger it. Okay, I'm not going to deny that it can't trigger it, and I'm not going to deny that it can't, I guess, acerbate. You know, but is it a direct is there a direct correlation between the two? I don't think so. I think it's hereditary. So like one of the studies I looked up did a study on like 96,000 kids, and basically they took kids that some of them already had a sibling with autism, and some of them didn't have siblings with autism. And then they did vaccines, no vaccines, and a couple of different other studies, and watched them until they were like 6 or 7. And there was no difference between the two. Like if you had a sibling, you were just as likely to get autism as if you didn't have a sibling with autism. So, and vaccinated and non-vaccinated, there was no outstanding number of kids getting autism from vaccines.
Yeah, that's kind of funny too. And kind of shying away from autism at the time. I was reading studies about, the ADHD, ADD studies with children.
Oh, those are bullshit.
And here's what's funny though, is that the prevalence of ADD and ADHD in France is quite lower than here per population per capita. And a lot of the hypotheses on those is diet. And do you think maybe with autism, possibly, maybe it's a diet thing?
Oh, absolutely. I mean, look at what we do to our animals. I mean, we're pumping all of our food full of steroids and chemicals and medications. I mean, our chicken is the chickens we eat in the grocery store grow in like 30 days. Okay, chickens aren't supposed to be that big in 30 days. All right, so
They're
the
juicing
same.
this a little bit.
Oh yeah, I mean, so there's definitely been a culture change in our food. Our food is not as fresh as it used to be, and it's pumped full of things we don't need to, we don't even want to know about. I mean, look at what and I blame Obama for this, but it probably wasn't him directly. I don't like that over the past previous 8 years, they made it a law or took away the law that says you have to identify where the meat came from in a grocery store. So if you look at the stickers on meat, it's no longer required to put where that meat came from. Isn't that weird? Like, why would somebody push that?
I,
Like, why would you not need to know that?
you know what? And it comes to almost a bigger picture too, of planet sustainability, right? This planet has been a finite size for billions of years, however long this planet's been around, right?
Yeah.
And it's only to support a certain amount of folks. So this is why for us, we have 340 million people in this country, you know, and
Yeah.
it's really strange because I mean you have to feed these people, Mike. They have to be fed, and we
Well,
live we
I don't
live in
think
a
we're running out of food, Josh.
no, 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 we're not. And the point I'm trying to make is that there's only so many animals you can have and make and that, and it would be really nice actually if we kind of got away from like a meat laden diet. Yeah, it's nice to have some meat now and then, but maybe we look into something that, sustainable, that maybe you grow a vegetable garden at your house if you have the applicable space, and maybe we use that, the scraps. It's funny. I'm
Yeah.
going down different corridors here, so if I get off too much, just tell me. But it's funny though. I was listening to TED Talks on NPR, right? And they
Yeah.
had a gentleman on there, and they're talking about carbon, emissions and things like that. And
Right.
it's really funny that a lot of our carbon emissions come from food and food scraps. Now we could sit here and use the food scraps. I don't know how you feed your goats at your
Well,
house. I know
well,
you use
that's
food.
like biodegradable. I mean, you talking about like the methane that comes off of something decomposing?
Yeah, and it's just being there to waste. We could sit there, use food scraps, let's just say we throw them in a pond and get them all nice and souped up, and then we feed them to our livestock instead of sitting here
Yeah.
and feeding them, you know, DDGs. And I still laugh. I know both of us worked in grain for a while. I just laugh when people say, "Oh, genetically modified, corn and beans and stuff." That's bad. It takes one thing to genetically modify a product, right? So
Yeah.
if you have beans that are, purple beans and they've been brown for thousands of years, yeah, you genetically modified it to grow purple. Now, are you
Right.
genetically modifying it to be, a killer tofu or something? No, absolutely not. And anything can be genetically modified, Mike. Mike, if we have two plants and we grow them together and they get a different strain or a different, DNA in them, they're
Yeah.
genetically modified per definition. I don't get it. I just
Yeah.
really don't. I'm getting old and I don't fucking get it.
Yeah, and I don't think people understand that you have to continuously modify like the corn strain and the beans and things, the things that we use all the time. It's in every ingredient, right? You have to continuously modify those or the plant dies off. Like if you tried to grow the same corn year after year after year, it would die off. It wouldn't continue to grow. I mean, I do believe that is why we do the modifications of them. We made it faster to grow, quicker to harvest, and I think it's like 90 days, right? I mean, you can plant corn 90
Yeah,
days, you have
yeah,
corn.
and the yields have gone up. I mean, even around here. Well, let's just talk like in the 1950s, right? And I'll just use this as an example. Corn yields, maybe, I don't know, let's say 75 bushels an acre, right?
Yeah.
I had guys coming in 2015, 2016 saying, my corn yields are, 200 plus an acre in some spots. I mean, that's ungodly. You had a four-time return
Oh yeah.
in 50 years or 60 years, sorry, in 60 years. And you're exactly right. If you don't modify it, then what? Then you don't have corn, and then you're not going anywhere. But corn's a different beast in itself, I think, since we used it for, there's so many subsidies for corn. I don't know who's in the corn um, gamble or not gamble, corn market, I guess you should say.
Yeah.
But high fructose corn syrup. Da da da. I mean, we don't use real sugar anymore in a lot of stuff. I mean, that's fucking nuts to me. Well, we use corn. Why? Why? Well, we got a
Right.
surplus of corn. Well, stop growing so much fucking corn.
I know, right? Why aren't we making fuels from corn? Come on now.
They're trying to, but it's
Yeah.
it's not effective.
Small quantity.
Yeah, it's not effective, and that's what's really it blows my mind. But getting back to pharmaceuticals
Yeah, look at the
here.
rabbit hole we're in now.
Oh, I love it. It's good,
Let's,
man.
let's get
It's
back to
good.
pharmaceuticals. You fuck.
Exactly. Well, I mean, it's all in the same thing here, but
So,
it's fun.
so still, tell me though, what's your standing on the pharmaceuticals? What do you like? What do you dislike? What do you
You
think could be
know,
improved?
what I obviously like is that there's so many options for pharmaceuticals and different medications to help people that obviously need help in some capacity, right? You sit here, you have the flu. Where do you go? You go in, they give you Tamiflu or something like that. It downgrades the symptoms. It get rid of the system. You sit in there, you have the clap or something like that. You go in there, they give you penicillin, and there you go. What I don't like about a lot of it, here's what I don't like about it, and it's really funny. The whole process here is that, let's say, the United States pharmaceuticals started getting popular, let's just say start of the 20th century, right? And the government got involved. And this is like the only time I'll even say this, and the government did right getting into it because,
What?
yes, check this out, right? They're they start with the Pure Food and Drugs Act in 1906, right? And that's actually a precursor or actually be a postcursor. Sorry, there's the Biological Control Act of 1902, right? And it required the federal government to have pre-market approval for drugs that they're producing, right? And then this
Yeah.
Pure Food and Drugs Act, it it just basically, the distribution from state to state, it told them, you got to say what's in this shit. But it's really funny though. We get down here, and I like it that you brought up snake oil, right? Because this is essentially what it was. And you said antifreeze earlier, right?
Well, yeah. I mean, we're still getting snake oil today.
Oh, we are. I mean, a lot of them too. But check this out. So in 1937, there's this there's Essie. It's, what is it? Massengill Company of Tennessee, right?
Yeah.
The the product that they had was some sort of elixir. It says elixir sulfa. Was it sulfonamide? There we go. And it had essentially the solvent in it that's used in antifreeze, the diethylene glycol, and it killed 100 people, Mike.
Yeah, but what they're trying to say with that though is I remember that, and there was an issue with that still recently, but what they're trying to say is it's such a minute quantity that it shouldn't matter. Even though it's an antifreeze, it's such a small quantity of it. It's not harmful, is what they're trying to say.
100 people died. How's it not fucking harmful?
Well, right, but I mean, look at the flu vaccine. I mean, that's killed hundreds of people. We still push it, and it's got less than 50% herd immunity. So that's
Right.
like the most ineffective vaccine on the freaking planet, and they still push it like you need it. And
How
what's even
how
crazier is
no,
last
go ahead.
year, they pushed the flu vaccine, and come to find out, the strain of flu that year was different than the vaccine that they even made, so it wasn't even useful. So I mean, and we didn't have this huge flu outbreak, right? I mean, it's like, stop pushing this flu vaccine. The only one I'm really mad about is the flu vaccine currently.
I could not tell. But
It's a
with the flu,
joke.
you know, uh, today when we get the flu, it's not a big deal, obviously.
Well, yeah,
Yeah,
we have doctors and medication that can help with symptoms and lower them, and you can work through it. I mean, back in the day, yeah, people died like crazy because of the flu, but we didn't have the preventative measures that we do now and the medicine that we can use now once we get it. I don't think we need a vaccine for the flu.
those are pretty bold words there, Mike. I'm gonna have to disagree with that. You see a spot where you lose 50 to 100 million people from a fucking flu. That's preventable. You know
In
what?
what
Yeah,
country?
across the world.
Well, yeah, but I mean, are you counting third world countries here? Because yeah,
Well,
obviously they need vaccinated because they don't have they can't just go down to the CVS and get whatever they got to get for their symptoms. They just have to power through it. And if you don't have the right antibodies to power through it, yeah, you're gonna get sick and sick and sick and sick and sick until you die.
so
But
you're you're
I
more
don't think
so
those. Go ahead.
you're more so saying the survival of the fittest, and maybe
Yeah,
even
what's
go
up?
even yeah, even with us, us talking about food supplies too. What if we don't have these vaccines and
Well,
the earth is taking the natural course of survival of the fittest? Well, you know what? You can't defend the flu. Fuck it, you die.
yeah, but I mean, I think the food industry is a separate thing. I mean, we definitely talk about that another time because I my view on it is I think more people should be growing gardens and raising their own livestock. There's so many people. I'll try not to get on a tangent on this, but there's so many people in the U.S. and I'll say mainly the U.S. because that's where we live. A lot of people can't fish, hunt. They don't know how to survive without going to the grocery store. Like, I feel like if trucks stopped today, grocery stores stopped getting food, and that was just the end of it. There was no more grocery stores. You had to fend for yourself, grow a garden, get seeds, provide meat. A lot of people would just fail and die off, and you would start seeing more guns, people going rioting, stealing stuff from houses because they need food and they don't know how to get it. But we can talk about that another day.
Oh yeah, you're right though. And the population in the United States, I mean, I don't know the current statistics, but I'll just get a ballpark. 75 to 80% of the population in the United States live in cities.
Oh yeah.
Live
Yep.
in
I agree.
cities, they don't live in beautiful Illinois like you do on a goat ranch
Oh yeah.
and have land to, raise goats and grow food. But with
Oh yeah.
the pharmaceuticals though, it's really interesting that we talk about the ineffectiveness of a flu vaccine based on statistics, right? But think of the
Right.
cost behind that, right? Think of the costs that are associated with it. Making drugs, medications it's tough business, and it's even tougher whenever you go through the whole process here. Some of the stats I got in front of me right now is that basically each year you may have 21 different drugs that are approved by the FDA. And 365 days out of the year, you have
Yeah.
21 that are approved. And check this out. What it's told
My
me that.
question to that real quick. My question would be
Yeah, go ahead.
how many of those drugs are already out there and that these are just a duplicate?
Oh, it very well could be, or just they changed something in the formula.
Exactly. And
And
that's very frustrating because it's a scheme.
oh yeah. And here's the funny thing on this too is that the prices here, these are some numbers I had from like 2012. The price for like a new drug from starting to finishing, right? Me and you make a drug. We make the Knuckle Dragon Billy Goat Review tonic. It cures what ails you basically. From
Comes out January 31st, people.
That's what I'm talking about. Be there, be square.
Pre-order
Yeah,
pre-order now.
yeah, be there, be square. But it's showing here that it's been estimated that the prices for that are 1.3 billion dollars for our Knuckle Dragon Billy Goat Review tonic coming out. I
Yeah, but
mean,
where do you think all that cost goes? What do you think that is?
that's its initial cost, Mike. Um, it says here, according to Forbes, and this is a 2010, development prices were 4 to 11 billion per drug.
So
And
what, like R&D or just producing it?
this is the whole development behind it. We'll just say production, R&D, testing, and the reason they have this though is that the way to for the approval and all this and the studies, because the way you get a drug through is, it's not just like, okay, well, I have a drug and they're gonna put it on some people and then it's gonna go. There's actually a four to five stage trial that it goes through, and there's initial. And I had,
Yeah, but there's loopholes in those trials too. Like I found out you can use the same people for the same trial,
yeah,
that's a scam because what they're doing is if you get certain results out of this group of people and you want to repeat those results because they were good, well, yeah, you give the fucking drug to the same people and you go, look, it was this amount effective again. But they're allowed to do that. I didn't
yeah,
know that.
yeah, that's interesting. And you have the same group there, and there's not a like a null group, and you don't. And essentially the way they test the drugs is that I give you a white pill, right? Me and you take
Yeah,
a white pill. You take the white pill, and they say, okay, this is drug so and so. This is a Knuckle Dragon Billy Goat Review tonic pill,
yeah,
and they say it should do this, this, and this. One of us get the pill with the actual medication in it, and the other one of us gets a sugar pill.
yeah. We get a
The placebo
placebo,
effect. You get the placebo effect, right?
right?
And they're like, well, yeah, of course this works. Maybe it does, and maybe it doesn't. But I mean, there's so much. It's just there's so much money. I think $11 billion for our tonic just to get out there. And then what happens?
Yeah.
Then what happens if the FDA doesn't approve it? It's not one of those 18 to 21 medications a year that's approved.
Well, it depends on which company you work for. I mean, all you
Yep.
got to do to get it approved is just, take the guy out to dinner, pay him off. You know how it works.
Yeah,
Money.
grease the hands, and that's what it really gets to. Is the pharmaceuticals is money, and we
100%, dude. And that's
we
what I found. It's the most sickening part of the whole thing is the amount of money.
I mean, it's crazy. They have some stats here. As they're talking about these doctors. They've found that they're given $500,000 for speeches. You know,
Well, shoot, not even that. I mean, do you agree that doctors get kickbacks for pushing certain drugs?
they have to, Mike. It's
That's
like,
disgusting.
yeah, if you run a tire shop, okay, let's just say you run a tire shop, right? And the Goodyear guy comes in there and says, "Hey, man, if you sell 100 Goodyear tires, I'm going to give you a Goodyear hat." Yeah, of course. If you sell 200 Goodyear tires, I'm going to write you a check for $1,000. And they incentivize using a certain amount of drugs. And what's really
Right, but does that make those tires any better than the other tires,
no, no, obviously not. It might, but at
It
the
could
same
even be a
time,
worse. It could even be a worse tire, but you're getting
yeah,
that kickback.
yeah. And that's what's funny. I'm glad you say that. With oxycodone and oxycontin, whenever they came out, I watched a documentary on this a while back. When they came out, like the drug, I don't know, not recruiters, salespersons, right? So I'm a
Right.
drug salesperson. I go into the doctor and say, "Hey, man, push my product. This is how much we're going to pay you in return for this." And obviously, the doctors are going to push it because they say, "Well, the research shows that this is good," and so on and so forth. And it's not good. I mean, see what kind of problems we have with that whole opioid situation in the United States. That is from doctors being basically not even forced, but you're going to look out for yourself. If I got a way to make money, I'm gonna make money. And even
Y-
if I just think, yeah, sort of, kind of, this might work for you, and it does. But we've talked about before is that after a while, your body's opiate system and your brain, you taking an opioid and you take an Advil are essentially the same pain relieving effects. And that's amazing to me. It doesn't
Yeah.
help. It doesn't help the system or symptoms. It actually decreases a lot of the efficiency behind it.
Yeah. That's that whole doctor situation for getting kickbacks is that I think that's got to go away. It's equal to lobbyists in government, how you can have billions of dollars spent on Congress to lobby them to vote certain ways. I mean, I think that needs to go away, and I think the doctor kickbacks need to go away. If I come into the doctor sick, I shouldn't have to worry about, is he going to give me the right medication, because I know he gets paid a lot of money if he gives me this one. Like I just want what's going to work, not what's going to benefit him.
Oh yeah.
That's it. That's it. I don't care if it's a super cheap drug or a super expensive drug. I just want the one that's going to work. And I know it's been shown doctors are giving people certain drugs that, yeah, they do kind of work, but they're getting a kickback from it. So they give that one instead of giving a different one.
Oh yeah, you're exactly right. And a lot of those too are the processes within, medical procedures. When I was talking to Dr. Anna Zackerson a while back, she was saying on average for like a procedure to get changed, let's just say the standard operating procedure for you, we'll just use the flu, right? The standard operating procedure for when you have the flu is you go in, they take your vitals, all this stuff, and the course of treatment is to give you Tamiflu, right? Now, let's say
Right.
the pharmaceutical industry comes up with another drug, Tamiflu 2, that's obviously different, or, whatever you want to call it, flu killer 6969 or whatever.
Mm,
It takes 17 plus years for that to be, you know, the standard operating procedure to change it. So, in the doctor's defense, they're maybe giving you the best thing that they can give you per their standard operating procedures, because a lot of these guys are licensed and insured. If they don't follow the
yeah.
the AMA's recommendations or whatever book of medicine they have to follow, they're liable. But here's the thing too, I really like what you're talking about with the kickbacks. I mean, that's terrible. That is absolutely terrible. And it's been,
Yeah.
think 20 years ago, Mike. What, 20 years ago we would have been, what, 13, 14 years old. Okay. I didn't
Yeah.
know what an opiate was. I didn't know people that had, pain pill addictions. I didn't know
Right.
this, that, or the other. And nowadays I know people that, take pain pills and they're addicted and they've essentially
Oh
moved to
yeah.
heroin because
Everybody's
it's cheaper.
everybody's got 5 friends that's got an addiction, right?
Yeah, everybody's touched by it, and that's scary. And these people wonder why we're still in Afghanistan and places like that. Duh, 90% of the fucking opium that we get is from Afghanistan.
I know,
Of
right?
course we're going to be there. Of course we're going to be there. We're not sitting there and fighting the global war on terror. And I hate to go out down this caveat. I'll make it really quick. You know, we're not there fighting the war on terror to, liberate the Afghani people. We give two shits less about the fucking Afghani people as a country. We don't care. We want to secure our opium fields, and that is the only reason we're there. Numerous Americans have died in Afghanistan, so me and you can have opium and opium derivative products. I mean, that is, I don't know, it's just crazy. And there's so many alternatives that could actually help, but
America.
there's no money in it, Mike. It all comes back to the almighty dollar, like you're talking about. I mean, what are your thoughts on that? Maybe some alternative medicines that you've heard of that would be maybe a safer alternative to some of the medications that we have out there.
Well, I'm not into the whole natural oils type of deal. I do believe in a healthy diet, and if we ate better, it would probably cure a lot of the problems we have, especially getting our gut bacteria back up to where it used to be. I mean, we're such a pussified nation now and world now that we're not drinking raw milk, and we're not eating certain foods anymore that give us that good gut bacteria. Which they have found a direct correlation between gut bacteria and brain function. So I think we're on a downhill slope. But back to doctors, I mean, one of the biggest misconceptions that I think people don't realize with doctors is they're not medication experts. And not all doctors are performing studies. I would say a vast majority of doctors aren't performing studies. If you go to your primary physician, right? I go see this guy in town. I'm in Paris, Illinois. This guy's not doing studies. This guy doesn't know what certain drugs do and don't do. The only way that doctors know when new prescriptions come out, or I'm sorry, new pharmaceutical drugs or new treatments, the only way they know is because somebody told them. And who tells them, right? The people who created it tell them. They have these sales reps. They come out. They boast about the drug. They boast about this new treatment, this new tool, whatever it is. The doctor doesn't know. He's just getting fed this, right, from the same people who put money into it. So obviously they're going to make it sound like the best, right? It's like mobile marketing to doctors. So I don't like that people put such huge faith in doctors, because they sometimes they don't actually know. and it's really frustrating. And I'll give an example, right? So, and this happens to me, and it's a super pet peeve of mine, and I argue with them every time, right? So every summer I get poison ivy really bad. I'm just super allergic to it. I get it from the wind. I can mow my yard and it's all over me, right? So I'll go to these walk-in clinics because it's quicker. Like I don't want to have to schedule an appointment with my doctor to go get medication for poison ivy. All right. So since I was young, teenager, preteen, I would get shots. I get a cortisone shot in my butt cheek, and the poison ivy's gone in a couple days. If I don't get the shot, I start to swell up, and it just sucks. So I go to these walk-in clinics, and they ask you, are you allergic to any medications? Well, okay. So first off, you're going to believe me when I tell you what medications I'm allergic to and which ones I can't have. Okay. So they're going to trust you on that. They ask everybody that when they come in. Are you allergic to this? Can you take this? Blah, blah, blah. Okay. So they'll put trust in you there. Okay. But now when I tell a doctor what medication I need for my poison ivy and what works for me, they totally blow me off as if I don't know what I'm talking about. Okay. So there's a couple different choices you can get, right? And they always end up sticking me with these prednisone pills. Prednisone works, okay, but it's very slow acting. Takes a couple weeks. It's an immunity blocker, okay? So you got to take it in the morning before your immune system gets up and kicking around. And basically what they're counting on is to suppress your immune system, which stops the reaction to the poison ivy. Well, that takes a while to happen, and then you have to bleed off the medication. So you take like 4 pills a day, and then 3 a day, 2 a day, 1 a day. Okay, you do that for like 2 weeks. Well, I'm telling this lady, like, look, that doesn't work for me. I need the shot. And she spits off some bullshit study that they did. Like, well, actually, we found that um, the pills have been found to be more effective than the shot. And I'm like, you're so full of crap. Like, I don't think they understand how long I've been dealing with poison ivy. Give me the freaking shot, and then I'll take the pills. So then I ask her about the pills. I'm like, look, am I only getting pills? She's like, yeah. I'm like, well, what dosage of pills? She's like, I'll give you 5 milligrams. Well, 5 milligrams of prednisone isn't shit. I need at least 25 to 50 milligrams per day to be effective for me, or it doesn't work. And you can tell I've had poison ivy enough to know what dosages work and don't work. I've been dealing this forever. And she sat there and argued with me. Come to find out, she's just a nurse practitioner. She's not even a fucking doctor. And it's just really annoying to me that doctors will listen to you when you say, this is what I'm allergic to. But when you know what medication works best for you, they totally blow you off and make your life hell. So I took this lady's pills, right? I took them for 2.5 weeks, still had poison ivy, had to schedule an appointment with my primary care physician, which made it worse because I've already had steroids in me. So now he has to be cautious about what he can give me because I've already had this dosage of steroid, which is the prednisone. So he still gives me a shot, and then he gives me an extra dose of pills. And of course, it's gone in a couple of days, like it always is when I get the shot. So I think it's a misconception that doctors actually know everything. They're just told stuff. They learn just like everybody else. They're taught what they know. And if they don't do any extra, they only know what they've been told. They don't do any extra research.
Yeah, you're exactly right. And it's real funny you say that. Since we moved to Indiana, I get sinus infections like twice a year, at least.
America.
At least twice a year. Well, I live in the pollution capital of the United States. I get them twice a year. And I'm like you. I'm not going to go schedule an appointment with my doctor because I know what I need. And I never thought about it until you brought this point up. Yeah, they do ask you, well, what are you allergic to? I could be like, well, I'm allergic to this, that, or the other. Okay, cool. And then I go in there and they're like, okay, what are your symptoms? And I tell them the symptoms. And it could be a doctor, it could be a nurse practitioner, it could be a nurse that can prescribe, well, a nurse that can prescribe drugs, a nurse practitioner, sorry. But, I said,
Yeah.
okay, I need a steroid shot and I need a Z-Pack. And I know in 4 days it's going to be gone. And I've had the same thing too, where they're like, well, you don't need a shot. How do you know you need a shot? I said, because it's worked for me in the past. Well, correlation isn't causation. Oh, yeah. Don't give me that bullshit. I
Oh,
was like,
dude, they hate hearing it. They hate hearing somebody else tell them what works best. Like, oh,
yeah,
how do you know? They have this hierarchy like, oh, I've been in college for this amount of years. Trust me, I know what works for you. When really, no, the fuck you don't. Most
no.
medical studies are done with less than 100,000 people, which is
Oh,
like
yeah.
0.0001% of the total world population. But they
Right.
apply those results to everybody. So
Well,
it's a
that's
fucking joke.
Well, you've taken statistics classes and that, and I've taken a few as well. They have an efficiency rate or an error rate of 2 to 5%, and
Oh my gosh,
and
just
if you're and if
statistics can be skewed in any way you want.
exactly right, and that's funny. I was reading an article this morning on NPR about saying parachutes are not as effective as using a backpack, and I'm like, what? So I'm sitting here reading through the article. And it's funny because you can skew the study in such a certain way, and I think that's what they do with the medication. And I think
Absolutely.
a lot of the medications is psychosomatic in a way. They say, okay, I'm going to give you this, and it's going to get rid of this, and your body starts thinking, all right, I'm going to get rid of this, and this medication is going to work, and it may or may not work, and it may not be effective as well. But with the doctors, they're in and out. It's not like on TV where you watch like Doctor House or you're watching, Chicago Med or Grey's Anatomy, where the doctors have to sit here and actually put thought into these problems that somebody's having. Somebody gets a seizure whenever they eat a red jelly bean instead of a blue one, and we found that out. So don't eat red jelly beans now.
Oh
The,
yeah,
the
now
doc-
nobody gives a fuck. They're like, yeah, I'm pretty sure you need this because I get a vacation if I give enough out.
yeah, and that's what it comes to, a lot of it. And I'm not saying all doctors are like that, but a lot of them, they just don't have the time to look into it, and especially when you go to these clinics.
Yeah.
Going to walk-in clinics are nice, but they also suck. I've
Well,
gone
yeah,
in there.
but sorry, did you know
No,
they
no,
do
no,
that
it's
with
fine.
vaccines too? Vaccines,
Just get
okay. So hospitals and clinics, okay, they get a a benefit from pushing vaccines. So there's a certain limit of vaccines they have to give out, a percentage of vaccines. And if they meet that, they get like a tax cut, a tax break. It's not a tax break. I can't remember what it's actually called, but they basically get refunded a certain amount of money for pushing out so many vaccines. So there's definitely a biased push. There's a there's an incentive to push out these vaccines. So whether you agree with it or disagree with it, they kind of have these hospitals and clinics by the arm by, saying if you don't push out this amount of vaccines, you don't get this money back. So there is an incentive there, and I don't think incentives lead to anything good.
obviously not. You know, Uh, uh, when you get money involved in things, money, as they say, is the root of all evil, and I truly believe that. Honestly,
Yeah,
you,
absolutely is.
you're going to sit there. I mean, if you came to my work and said, "All right, if you get 80% of your jobs done for the week, I'm going to give you an extra $500." Hell
Yeah, here
yeah.
here come the shortcuts.
Yeah, here, shortcut city. I could fill out paperwork and say, yeah, this job's done. I don't care if it's done right. I don't care if it's done at all. I'm making my money and I'm doing me. And I think that's the major flaw in the pharmaceutical industry. I think pharmaceuticals overall, they're a great concept. And yes, the advancement of certain medications throughout the years have really helped our society. But now we've gotten to the point where a lot of it is monetized and incentivized, is like you're talking about, and the effectiveness of it, I don't know. I just can't get behind it, and that's why I'm so much on the fence about pharmaceuticals. I think overall they're good, but
Well, yeah, but I also think we're getting snake oiled.
oh yeah, obviously. I mean, we don't know. I'm not going to sit there and do a study on a medication I get, right? An in-depth
Right.
peer review study. I'm going to go on Google, right? And I'm going to Google my medication that I'm supposed to take, and I'm going to read what somebody wrote, and I might read some stuff that people posted in comments. And I'm like, okay, cool. But I'm not sitting here doing like a really in-depth analysis, of the chemical compounds behind this and what these possible side effects are. I just know that a doctor that supposedly knows a lot of stuff is giving me a medication that supposedly works, and hopefully it works for me. I mean, it's just
Yeah.
amazing. It's just
Yeah, but I mean,
amazing.
you can look up studies on some of these things, and I want to just read you a couple numbers here that I thought were really they came off as alarming to me, and I'm taking them as factual. Okay, so there was a 2015 Harris corporate reputation poll. So basically, they look at a specific industry and then they rate their reputation. Okay, so it measures the quality of an industry's reputation. So the pharmaceutical industry ranked ninth out of 14 industries that were polled, and they had a 37% public mentions being positive. Okay, so only 37% of the pharmaceutical industry was looked at positively. Okay. And then this one's from the Mayo Clinic, right? So they do a lot of really good research. So nearly 70% of Americans are on at least one prescription drug. Okay. Over half of Americans take two prescription drugs, and 20% of Americans are on at least five prescription drugs. Okay. I don't believe people need to be on that many medications. And I think it's seriously starting to get to the point where it's like, they're creating problems that aren't problems to create a medication for it. Okay, it's fake. It's a lot of these medications I seriously believe are fake, and the way it's set up, the way things have become like legalized, it made it worse. So companies can start advertising for a drug prior to even creating the drug. So this is useful for people who want to get into a space, the pharmaceutical space, that don't actually have anything to cure. Okay. Like people aren't getting random illnesses anymore, right? That's just not happening. We have too many medications. Okay. We have too good a healthcare for people to be getting brand new, crazy, weird, mutant fucking viruses. Okay. That's just not really happening on a wide scale anymore. So what they can do now is they can say, they can start advertising prior to a drug being created. So they'll start marketing on TV to get people's interest in it. Like, oh, does your big toe hurt when you turn to the left? Do you get headaches when this? But they won't mention a drug, right? They'll just kind of stick that out there. And if they can get more people to recognize it, then you bring the drug into it. Oh, do you have this, this, and this? People are like, oh, I have had that, because you can fucking relate to almost anything, right? Yeah, my toe has hurt once or twice when I turned. Is that I didn't know that was a problem. And now that you have somebody telling you it's a problem, you're like, oh, I didn't know that was a problem. I should fix that. Oh, well, we just happen to have the fucking medication right here for you. This is all you right here. And now you're stuck taking this medication for the rest of your life because you think it makes your toe feel better when you turn to the left. you know?
Oh, that's a very interesting insight on it,
Like, how's
and
that legal?
it's America. It comes down to money. I'm gonna go back to money. It goes down to money. It's always money, always. 100% of the time, money. And I like those facts you brought up. You said what, 37% satisfaction rate
Yeah,
of the pharmaceutical market. You know,
that's it.
ninth out of 14, and you said 70% of Americans are at least on what, one prescription drug. And when you say prescription drug, you mean maybe like a maintenance type drug. Maybe it's high blood pressure. Maybe it's
Yeah, yeah.
depression medicine. You know, I take Zoloft. I take 100 milligrams of Zoloft a day.
Oh, be
Now,
careful with that one, buddy.
I know I've taken it a few times in the past, but uh, with that, yeah, you know what? It's helped me quite a bit. It really has. But is it something I'm going to have to take the rest of my life? I hope not. I've made changes in my life that uh, I'm hoping to get away
Yeah,
from. That's like with high blood pressure and things like that. You know what? Yeah, I do believe that some people are genetically predisposed to have high blood pressure. No matter what they do, they could be marathon runners and have high blood pressure. But a lot of it comes down to the basics, you know, diet, exercise. You know,
yeah.
you put bad shit into your body's going to react adversely, period. End
No,
quote.
absolutely,
Eh,
absolutely.
I just, you know, it's the pharmaceutical market, you know, it comes back to that instant gratification. Yeah, I take a pill to make me feel better, and I know it's going to make me feel better. But this is even another conversation we can have some other time. You know, what's the main culprit behind you feeling that way? Well, and you start thinking about it. Well, and that's it. That's where you're at. So
Yeah.
I guess in closing here, Mike, what's your final views on the pharmaceutical markets and what do you think maybe good, bad, and the ugly about it?
So I mean, we can't deny the fact that it helps people, right? But there's also a definite money issue, and I want to just bring up a couple more little things before we close out here. I know we're coming up on our hour. But there's a big misconception too that the reason that drug prices are so expensive is because of R&D research, when that's not entirely the case. Okay, so they've done plenty of studies. There was a huge one that I'll have to bring up next time, but it was done between 2011 and 2017. Okay, also done by the Mayo Clinic, I believe. And so off of that, for every $1 a pharmaceutical company spends on R&D, they then spend $19 on advertising. So
That blows my mind. That's
yeah,
19 times more on
yeah,
advertising. Whenever I would think those numbers would be reversed. You
right,
think
but
you
it's
would.
not.
Oh, that's holy cow.
Yeah, and it's only us in Sweden that are allowed to market this way. It's been banned in every other country. So in other countries, you can't market, you can't advertise the drug, what it does, and how much it costs. Us in Sweden are the only countries that are still allowed to do that because it's been deemed like unethical in other countries. But still, we're allowed to do that. You can market drugs to people over TV, and you can make them believe whatever you want, which comes back to you can market drugs prior to there even being a drug. You can create a problem and then create the fix. It's
Yeah.
insane.
Yeah. Does your butthole itch? Well, yeah, I remember one time my butthole itched back in 1993. Well, you need this butthole itch cream. Okay.
Yeah, yeah,
Woohoo.
absolutely.
Hey, guess what? My butthole doesn't itch anymore, and it might not have itched since 1993, but you know what? I have this cream, and it's amazing. And obviously, you know what? Medications are good. Yes. And, empirically, a lot of times they are good. They're needed. They are needed. That's why we live in such a standardized, high quality of health country. I mean, you can't deny with the inventions with pharmaceuticals and better healthcare. The life expectancy of folks has skyrocketed in,
Oh
in, mo-
yeah,
in most countries, with the United States being the exception. I think our life expectancy rate has actually decreased over the last decade. But
probably because of suicide rates.
well, that could be, just a lot of different things into that. It's probably gun violence, Mike.
Oh
Tri-
yeah,
Triggered.
triggered.
Well,
Let me get these last two out there because I think they're also really
oh, go
interesting,
ahead.
and
Yeah,
and they
go ahead,
have they
buddy.
have to do with the money side of things too. Okay, so check this: 51% of drugs prescribed to Americans are generics. Okay, so 51% of the drugs we get are generic versions of them. Okay, but they only make up 8% of the country's total amount spent on drugs.
Get out of here. No way.
Yeah.
No
So
way.
so we buy them 51% more of the time, but they only account for 8% of the revenue generated by drugs.
That's crazy. And even getting with prices too, we see the prices. I see it on, some of the research I did. If a drug costs a certain amount, why is it not the certain amount in each country? United States,
Oh,
we can go across the border. We can go to Mexico. We can go to Canada. We'll use Mexico and Canada as the people that we're going to talk about. I can go across the border in Canada and get drugs, the same drugs. Let's just say I got ED or something, right? And I
yeah.
get my ED medication, and let's say it costs $100 in America, right? I
Right.
go to Canada and it's 60. I go to Mexico, it's 20. It's the same exact chemical compounds behind it.
Yeah, here, right here. I got a list for you, buddy. Here, let me
Go,
read these out.
oh my, yes, thank
I
you.
got a list. So this is medication and dose for price in the US, and then I'll give you the price in Canada. Okay. So and I probably can't pronounce most of these. These aren't well-known drugs, but it just shows you the difference in price between country to country. Okay, so this one is Berlinta at 90 milligrams. It's $5.64 per pill in the U.S., and in Canada it's $1.67. Okay, and then I'll just give you an extreme. Okay, so an extreme would be it's something called Gilenya and zero point 0.5 milligrams. Okay, per capsule of a zero point 0.5 milligram tablet is $252.13 in the US. In Canada, it's $91. Okay. Um, but let me read you this last one here. Okay, this will give you a real markup and show you what the drug companies are really doing. And this is all legal. This is all perfectly legal. There's no restrictions on them. They can charge whatever they want. Okay, so the percent markup of Xanax is almost 570,000%. Okay. So per 100 tablets, you're paying $137.79 on average, but the cost of the active ingredient is only 2 cents. Is that not like out of this world?
That is amazing. It's so cheap, and that comes back to the prices behind it. And it's funny, you know what the Glennia is for here? I googled it while you're. I just had to know.
Yeah.
It's used to treat multiple sclerosis,
Oh, that's pretty
relapse,
common, right?
MS. You know, and essentially it prevents the immune system cells from attacking nerves in the brain.
Oh, geez.
Yeah, I know. It's crazy. I don't know, Mike. I
Oh,
don't know.
you're gonna love this one. I'll give you one last one, okay?
Oh
Then we can
yeah,
wrap this up. I
give
promise.
it, give it to me, baby.
This is gonna really put it in perspective, okay? So the U.S. accounts for 45% of all revenue generated by pharmaceuticals. If you combine all other countries together, they only amount to 55%. So we handle 45% of the entire world's pharmaceutical revenue, whereas if you combine the rest of the countries together, they're only 55%.
We're 45% is one country, and the other 200. I think there's 216 other. I think there's 217 nations on Earth. Maybe
Yeah.
don't quote me on it, but holy cow, holy cow. That's all I gotta say. Holy cow.
Oh yeah. Yeah, yeah. So proportion of total pharmaceutical revenue for the 13 largest pharmaceutical companies from sales in the U.S. versus sales in other countries. And this is from 2000. This is the one I was telling you from 2011 to 2017. And I swear I'm going to wrap this up.
No, it's
Okay.
fine. No worries, buddy.
So in the U.S., with 4 to 5% of the world's population, okay, and 33% of the developed world's population, we cover more than 45% of all pharmaceutical revenue. So we have dramatically less population than the rest of the world, but we still cover more than 45% of the total revenue generated from pharmaceuticals. We're getting hosed.
USA, USA.
Greatest country in the world to totally fuck
greatest
you.
greatest country in the world to definitely fuck you.
Yeah.
That is great. And
Well,
speaking,
well, buddy, do you want to do like a part two to this sometime? What do you want to do?
yeah, well, I mean, these are good conversations we can have after the fact, really, you know. And this is we had a really good talk today on this, and I know for our listeners out there, and I know for you, we kind of went down some different rabbit holes, but I like doing that because it gets us to think in a non inside the box technique, I guess you should say. You know, there's a lot of different arms that come off this, you know, and at the Knuckle Dragon Billy Goat review, we'd like to explore those arms, and they might not necessarily be popular opinions, and hell, even me and you have different views on this. You know, we
Yeah, I'm
really
right.
do.
You're wrong.
Yeah, obviously, right? Yeah, yeah. That's exactly it. But there's just so much that we can do out there just to get the information out. And I know for me, and I know for you as well, is that we want to get that information out there, right, wrong, or indifferent, but we want to have it out there so people can critically analyze their situation. So I think here at the Knuckle Dragon Billy Goat review on this fine Sunday morning, the pharmaceuticals part one of part whatever, I think we could almost have a weekly show on pharmaceuticals alone. I mean, this is how vast it is, you know, really. But Mike, I appreciate the time this morning, and I'll see you next week on a podcast. So.